Welcome, everyone. Welcome to this Medicare session at 2 p.m. today, Wednesday. Thank you for your time. Thank you for wanting to learn more about what Medicare is. We have an exciting presenter today, and he is an expert in this field. And so we are very thankful that he can be with us today. I'll present him shortly. Before I do that, my name is Marianela Morales, and I welcome you along with our team here as staff, conference staff. We have Reverend Robert Besser, who's our center director. We have Mark Helms. We also have Patricia Goforth-Rakes and myself. We welcome you. We thank you for being here. And without further ado, I would like to ask Reverend Besser to join us with a prayer. But before I do that, I do want to let you guys know that this webinar will be recorded. It will be posted on the website as well as emailed to all the participants in the plan. And also, if you have any questions throughout this Medicare session, please post them in the Q&A. And during the presentation, I will let our presenter know. The presenter for today, his name is Michael Steele. He's with the Alera group. And he's an excellent person as well as very notable and as well as an expert in the field. So now, Reverend Besser, would you please start us with a prayer, and we will go ahead and transition to Michael. Thank you.
Thank you, Marianela. Will y'all join with me as we pray together? Gracious and loving God, we give you thanks for this time together that we have. For the many ways that you provide for the people, that you provide for the ministries of the Texas Annual Conference. Bless the information that will be shared by Michael. We pray for clarity of all that he will present, for those who are listening and will listen, for the understanding for all of us who make these important decisions for our own selves, but also for our families, for our churches, and for our loved ones. Remind us, God, that behind every policy and every number is people, pastors and families. You call us all to serve you with strength and with joy. So guide our hearts toward wisdom, so that we can all work toward encouragement, and that our work may be for your purposes of care and connection. God, we ask these things in the name of Christ, our healer and our sustainer. Amen. Michael, again, thank you for being here. I'm going to turn it over to you to begin our session. Thank you.
You bet. It's great to be with you today. My name is Michael Steele. And for the last 24 years or so, I have been a licensed insurance agent and a certified financial planner. And it's just a real delight to be with you. Today, we're going to discuss Medicare, the ins and outs of Medicare. My agency partnered with your benefits brokers several years ago, and my agency focuses on the individual marketplace and the Medicare space. And so today's agenda will revolve around these items here: transitioning from group insurance into individual Medicare, how that works in practice, what is Medicare and how does it work and how does it function. We're going to talk about your supplemental Medicare plans to original Medicare, as well as compare and contrast Medicare, the Medicare Advantage program. We're going to also talk about your rights and responsibilities under Medicare. It's very important to enroll in Medicare at the appropriate time, or else you could face some pretty stiff and onerous penalties and late enrollment penalties and delays in getting your healthcare coverage. And so we want to try to avoid that at all costs. And finally, I'll open it up at the end of the session for some Q&A and provide you with my contact information in case anybody would like a one-on-one individual consultation. We'd be delighted to speak with you individually. So Medicare was signed into law back in the 60s. Lyndon Johnson actually signed Medicare into law. Healthcare was a heck of a lot different in the 60s, obviously, than it is today. Over that time, Medicare has changed very little. There have been incremental additions added to Medicare, such as the Medicare Part D program, which was added with the Medicare Modernization Act in 2006. Oddly enough, there's not a lot of dental and vision under original Medicare, but with that Medicare Modernization Act, Part D was added. What was also added were these Medicare Advantage plans, the Medicare Advantage program, which we're going to talk about in more detail here in just a minute, does have quite a bit of ancillary benefits associated with them, such as dental, vision, hearing, and so forth. And so, if that's important to you, those types of ancillary benefits are available under a Medicare Advantage contract. Back in the 60s, healthcare was completely different. Original Medicare in its original form was established as a national fee-for-service framework. And so what that means is it's very valuable, because what that means is original Medicare is completely non-network. That means you can see any doctor, any hospital nationwide, wherever Medicare is accepted, which is really, really kind of nice. And that's very unique to Medicare. There's just not a lot of private commercial insurance available in the marketplace that's set up as a national fee-for-service framework. And finally, I would emphasize that Medicare is comprised of three distinct parts. You have Medicare Part A. A is an alpha, is your hospitalization insurance. Medicare Part B is your medical insurance. And Medicare Part D is now your outpatient prescription drug coverage. So let's break down these three parts a little bit and discuss what they entail. So Medicare Part A is hospitalization and skilled nursing facility care. SNC stands for skilled nursing confinement. So this is Part A is funded out of the Old Age and Survivors Trust Fund that the government set up. You typically will not have a monthly plan premium associated with Medicare Part A, because a portion of your payroll taxes that you pay through your employer each month and every year go into funding this trust fund that the government has set up. Enrollment is generally optional. Okay, so Medicare Part A enrollment is optional. When you turn 65, or when you reach the age of 65, or if you have a spouse that reaches the age of 65, as long as one of you, either you or your spouse, are working full time and you're carrying your creditable insurance coverage through your employer, then you do not need to enroll in Medicare A and or B until such time as you retire or go part-time and come off of that group insurance plan. At that point in time, you would need to enroll in Medicare. So because the Part A trust fund is funding Medicare Part A, there's not a premium associated with it, and enrollment is optional at age 65 or not, so long as you're carrying some type of creditable coverage through your employer. Medicare Part B Bravo is your medical services. Anything under the sun medical related falls under Medicare Part B. This would include outpatient coverage, surgical procedures, doctor visits, durable medical equipment, and so forth. You can see I've updated the 2026 numbers because I assume you probably are forward looking. We're almost into 2026, and you'd like to see some of the premiums and deductibles and copays for the new year. I will preface this by saying that we have received some preliminary numbers for Medicare for 2026 2026. However, these numbers are not firm quite yet. They're not set in stone until Medicare officially releases them, and that won't happen until late November or early December at the latest. But I wanted to at least get some of these preliminary numbers in your hands and available to you. So for 2026, Medicare Part B's standard premium is $206.50 per month. Okay, now I will tell you that Medicare Part B is means tested. What this means, it's kind of like similar to our tax code. You know, the more money the more W-2 income or the more adjusted gross income that you have throughout the year, the more expensive or the higher tax bracket you wind in. Same thing with Medicare Part B. The more money you make, the higher this $206.50, this Part B premium can go. Now, for most people in the middle income tax brackets, you're gonna pay $206.50. Now, the reverse is true as well. If you or your spouse is deemed a low income beneficiary, this Medicare Part B premium could be reduced or eliminated altogether. So it kind of works both ways and has an inverse relationship there. Medicare Part D, this is your standalone prescription drug coverage. This was added in 2006 with the Medicare Modernization Act. This, with original Medicare, Part D is standalone. It's not integrated with your hospital and medical, very similar to what you have now through your employer, where I imagine your prescription coverage, your formulary is integrated, it's built into the hospital and medical. So this is not the case with original Medicare. If you opt for original Medicare, you must also purchase a standalone prescription drug plan. These are formulary driven, very similar to what you have through work, in that with Medicare Part D, you have a 5-tiered formulary structure. Tier 1s and 2s are your generic medication. Tier 3, 4, and 5 drug-related medication are your name brand medication and high technology drugs. These are the very, very expensive medications that hopefully you don't have any of those, but they are covered under the Medicare formulary for you just in case. Prices range anywhere from zero. There's still at least one zero premium Medicare Part D plan available for next year, all the way up to over $100 a month, depending on the richness of the formulary and which medications are FDA approved medications are covered under that specific formulary. Let's break down the original Medicare a little further. Medicare Part A functions very similar to, in structure, A and B function very similar to what you may have through your employer, in that you have some type of deductible under Medicare, plus co-insurance and potential co-pays, very similar to what you have, whereby you likely have some type of deductible where you pay 100% of your medical expenses through the deductible, and then a certain level of co-insurance kicks in. Medicare is very similar to that in structure and design. So if your Part A is your hospital and skilled nursing, Medicare has a per admittance hospital deductible. For 2026, the deductible has gone up. It's $1,716. So the first 60 lifetime reserve days in the hospital is subject to a per admittance deductible of $1,716. Now your hospital days under Medicare, believe it or not, are cumulative, meaning they add up against you. So if you ever find yourself in a situation where you exceed those 60 lifetime reserve days in the hospital, what happens then is you go into daily co-insurance, and this can become very, very costly and expensive for you. So days 61 through 90 and 91 through 150 carry upwards of $858 daily that you would be responsible for inpatient hospitalization. And we're going to show you in a minute how we can close all of these gaps. For now, I just kind of want to give you an idea of the basic structure of Medicare. Part B, again, is your medical. The design of Part B is much more simplistic. This falls under the famous 80-20 split. So in other words, Medicare pays 80% of all of your Medicare approved, CMS approved, eligible medical charges, and either you or your supplement are responsible for the 20% that Medicare Part B leaves off and does not pay. You are responsible for that 20%. All of this, any Part B charges are subject to a calendar year deductible of $288 annually. Now, unlike the Medicare Part A deductible, which can be every time you go into the hospital, remember that Part A deductible is very high, and it's a per admittance hospital deductible of $1,716. The Part B deductible is annual. So regardless of how many times you see a provider or need surgeries or need any other outpatient services, this deductible will not exceed $288 for the calendar year, which is kind of nice. That allows you to plan for your out-of-pocket expenses under Medicare. Finally, Part D, the structure of Part D, again, is a 5-tiered formulary structure. The deductible, the annual deductible in 2026 has been scheduled for $615. This is an annual deductible. Typically, the insurance companies will only make the deductible applicable to tier 3 through 5 medications. So if you're one of those lucky folks that are on a handful or less of maintenance medications that fall under the generic category, typically the deductible will not apply to these generic medications, only the more expensive name brand drugs. And again, 5-tiered formulary structure whereby your tier 1s and 2s are generic, tier 3 through 5 are your name brand and high technology drugs. So let's dive into the Medigap plans. Now, these Medigap plans are commonly referred to as Medigap. They are Medicare supplement insurance plans. The names are synonymous. A Medigap plan is a Medicare supplement plan. These plans, these Medigap plans, are federally standardized, and they're designed to go alongside your Medicare, your original Medicare. They almost fit Medicare like you'd put on a well-fitting glove, in that between Medicare and the Medigap policy, virtually all or the lion's share of your out-of-pocket expenses that you're responsible for under Medicare would be covered under the Medigap, which is really, really nice. They're almost airtight policies in that they cover the vast majority of what Medicare leaves off as your responsibility. These are federally standardized. They're sold in plans A through N. This was done in 1992. All the state insurance commissioners, but I believe 3 states, got together with the feds, and they sat down at the table and they decided to federally standardize this coverage, which is very nice for you. It makes it very transparent and very easy, relatively easy for you, the consumer, to select a plan, because you know, no matter which company you're looking at, be it United Healthcare, Cigna, Aetna, Mutual of Omaha, you're gonna be presented with the identical policies. So this is very transparent for you. Now, the go-to plans, in my mind, for 2026 and really and beyond are the plans G and the plans N. These 2 plans are going to offer you the best combination, broadly speaking, the best combination of coverage versus premium. So these are overall the best buys in the market, and they have the most breadth, because most of the carriers that are competing for your business are offering at least these 2 out of the federally standardized set of plans. Again, remember, original Medicare is set up as a national fee-for-service framework. That means if, God forbid, you came down with cancer and you wanted to go to the Mayo Clinic in Ohio, or you wanted to use MD Anderson, or you wanted to go somewhere in California where they have very specialized, very focused treatment on the cancer that's affected you, that specific cancer, then as long as they're accepting original Medicare, this Medigap coverage would be accepted with that particular provider. So the Medigap follows along with Medicare. Medicare becomes your primary, and this Medigap travels with you wherever you go. Wherever Medicare is accepted, this Medigap is accepted by default, which is very, very valuable coverage. That's very difficult to find this type of coverage in the individual market, aside from Medicare. So really provides you with, a national a framework, a national presence whereby you can pretty much see any doctor or hospital you want without a referral, so long as that provider is accepting Medicare, your coverage is good there. One of the other areas of this Medigap that I really like, and I would point out to you, and I think is very valuable, is that this is guaranteed renewable coverage. This is a provision that you find in some, not all, but some individual health insurance plans that allow you to renew the policy as is for as long as you live. And so this means you can never be dropped, you can never be canceled, you can never be charged a higher premium than your neighbor down the street. The only way you would be canceled is if you decided to simply stop making the premium payment. And you do have that freedom, you do have that right. You can literally call the insurance company and tell them to stop the bank draft and to cancel your policy. You can do that at any time. But so long as you're paying that premium, no matter what, the insurance company can never drop you. What's more, the insurance company can never retroactively change the terms and conditions of this plan G or this plan N, so long as you're renewing the policy and paying the premium. Extremely valuable coverage. You can go anywhere you want, and you have the coverage. Once you've been issued a policy, you can never be canceled, even if you file $2 million worth of hospital and medical bills. So extremely good peace of mind to know that once you have this coverage, it's rock solid. You're never going to lose it. The premiums vary, okay? So just about like any type of insurance, be it life or auto or home, you're going to see a variance in the premium. Some carriers are more competitive than others. Some carriers decide to have a bigger presence in this market than others and more breadth. And so as a result, you're going to see a pretty wide range of premiums. They're rated as follows. Typically, a Medigap policy is going to be rated by area, by your zip code, the zip code in which you live, also gender, tobacco usage, and age. Now, we've broken down original Medicare and the Medigap. Now, that's the apple, so to speak. Now, I'd like to talk to you about the orange. Okay, this is the alternative to original Medicare and a Medigap. This program was really expanded in 2006 with the Medicare Modernization Act. This is called Medicare Advantage. So a Medicare Advantage plan is a privatized alternative to the original Medicare program. So if you sign up for a Medicare Advantage plan, you're effectively being removed from original Medicare and being transferred over to a private insurance company, such as United Healthcare, Cigna, Aetna, and the like. Most of your household name, very large insurance companies with a national presence, they offer this Medicare Advantage coverage to you. And these are a private alternative to the government-run, the CMS-approved original Medicare program. These plans work differently than original Medicare. Now, they're required by law to cover every procedure, every test, every hospital charge that original Medicare would normally cover. They're just structured differently. The plan design is structured differently than the famous 80-20 split that we just talked about with original Medicare. So these plans are designed to combine your hospital, your medical, Part A and Part B benefits, as well as your Part D benefits. So a Medicare Advantage plan is going to look and feel in structure more like what you have through your employer. In that, it's an all-in-one plan, so it combines your hospital, your medical, and your prescription drug. It also, these plans will typically have deductibles. Some of them have deductibles. More often than not, you're subject to what's called co-payments and co-insurance amounts. So little different than original Medicare here. Something, that you really want to look into. You want to look into both of your options, and you want to very carefully select the appropriate option for you based on where your comfort zone lies. And we're gonna talk more about that in a minute. These Medicare Advantage plans, unlike original Medicare, these are going to be networked. Okay, so that's something you're going to have to contend with. These Advantage plans are either going to be PPOs or they're going to be HMOs. Now, HMOs are much more restrictive networks. These are health maintenance organizations. I typically do not recommend an HMO if you're concerned about unexpected, medical events that could pop up whereby you may need to see a specialist or go to a certain facility that may not be in your service area. Then an HMO is going to be probably the least likely option that you would want to take because of those restrictive networks. HMOs also typically will require referrals to see specialists. So you're going to have a gatekeeper, what they call a gatekeeper, which is you're going to be assigned to a PCP or a primary care doctor, and that PCP must then refer you over to a specialist that's in that, relatively tight network, that HMO network. PPOs are much less restrictive than that. With a PPO, you can see any doctor in or out of the network. If you choose to go see a provider that's out of the network, you're going to pay quite a bit more. The out-of-pocket maximums, the co-pays and co-insurance amounts will usually double when you're seeking services from an out-of-network provider. So again, all of those come into careful consideration. Whether you opt for original Medicare and a Medigap or a Medicare Advantage plan, you must maintain Medicare Part A and Medicare Part B. And remember, Part A is free, but this Part B carries a premium in 2026 of $206.50, subject to change, but these hopefully will be the final numbers in a few months. $206.50 is your standard Medicare Part B premium. If you select an Advantage plan, you must maintain A and B of Medicare. And so you cannot get around the $206.50. Aside from that, oddly enough, many Medicare Advantage plans carry with them a zero monthly plan premium. So unlike the Medigap that goes alongside original Medicare, these Advantage plans will give you all those Medicare benefits plus a little, dental and vision, and some gym membership. Some of them have. Many of these plans have these ancillary benefits like dental and vision that original Medicare does not cover. All of these, an all-in-one plan for zero premium. But again, you must maintain Part B. So the Part B becomes a constant, the $206.50. A lot of people, when their first reaction to that is they look at that and they say, well, Mike, that sounds too good to be true. How can I get all of my hospital, medical, prescription, dental, and vision? How can I get all of this for a zero monthly plan premium to the private insurance company? And this, it sounds too good to be true, but it's actually not. So what happens behind the scenes is if you get signed up for an Advantage plan, what happens is original Medicare transfers their risk of the 80% that they're on the hook for. They transfer this risk to the private insurance company in exchange for a monthly plan premium. So the private insurance company like United Healthcare, they can afford to offer you a zero premium because they're collecting, let's call it $1,000 a month from the federal government to insure you completely. So it's just a risk transference mechanism whereby the government transfers the risk of the 80% of that they would normally have to pay to the private insurance company in exchange for a monthly plan premium. So I hope that helps describe to you how these Advantage plans can offer these zero premium plans. And again, these Advantage plans, we talked about many of these items because they're zero premium, right? They work, and again, they work differently than original Medicare and the Medigap. They have copays, co-insurance, and sometimes, in some cases, deductible amounts that you're responsible for. So they do not, an Advantage plan is not designed to cover all or the lion's share of your out-of-pocket expenses, you know, like original Medicare and this Medigap is designed to do. So they look and feel a lot different. As a matter of fact, if you're out of network with the PPO, your out-of-pocket expenses under an Advantage plan could exceed $11,000 per year in 2026. So again, something to be made aware of and to carefully weigh your options. We've talked about all this. Prior authorizations. This last bullet point here on this slide, this is very important, and this has become even more salient here in the last 6 months. My theory is we had a lot of elderly people, and really people in general, were putting off their health care during COVID when we had those lockdowns. And so as a result, a lot of people put off surgeries, put off physical exams, and put off medical procedures that they normally would have nipped in the bud and taken care of right away. But COVID kind of disrupted all that. And so as a result, pretty much every insurance company across the board in every market is experiencing an inordinate amount of claims coming in. And these Advantage plans have been particularly hard hit by these extraordinary claims that have been coming through over the last 12 months or so. And so as a result, unfortunately, we've been, you know, getting a lot of negative feedback on these Advantage plans and what they pay. And unlike original Medicare, many of these Advantage plans, they have the latitude to put in place this prior authorization. Basically just means that an Advantage plan has free rein to question or deny a claim. Whereas original Medicare really doesn't wade into the weeds with denying a claim. They normally pay the claim first and then ask questions later, versus the Advantage plan where they ask questions on the front end and then reluctantly seem to pay the claims on the back end. So this is a big difference, one of the most distinct differences between the two plans, and it's definitely a consideration for you. What are your rights and responsibilities under Medicare? It's very important to understand the basic. You don't have to know all the rules, but it's very important to know the basics of the enrollment in Medicare, because a delayed enrollment could cost you a lot of money, and it could put you in a position where you have you're going to be without insurance coverage for some time until Medicare's late enrollment period opens back up. And so we want to avoid that. So broadly speaking, as I believe I had mentioned earlier, if you're working full-time, or if your spouse is working full-time and you are being covered under your plan or your spouse's plan, that spousal that group insurance plan through work is considered creditable coverage. And so legally, you can defer Medicare Part B. Doesn't matter if you want to sign up for Part A, that's completely up to you. So when you age into Medicare at age 65, if you want to go ahead and sign up for Part A, that's okay. I will put a little aside in there on that. If you have an HSA policy and you become Medicare eligible, there's some potential pitfalls with regard to those HSA contributions while you're Medicare eligible, even if it's Medicare Part A. So what I would encourage you to do is, if you have any questions as to the penalties or your Medicare, your HSA qualification and Medicare, I would encourage you to just give our office a call or shoot me an email, and I can give you some more granular information on that. But let's assume you don't have an HSA. If you just have a regular qualified plan through your employer, you can either elect to take Part A or Part B, so long as you're working full time. But when that day comes, when you ultimately decide to retire, or your spouse decides to retire, if you're being covered under your spouse, then you need to enroll in Medicare B. That's very important. You do not want to break in your insurance coverage, nor do you want to incur any kind of very large penalties for a late enrollment. So typically 60 to 90 days in advance of your retirement date, you'll want to go into your account at ssa.gov and complete an application for Medicare A and or B. Okay, 60 to 90 days in advance of your retirement date, and the end date on your group insurance is appropriate to apply for Medicare. Okay, otherwise, late enrollments. I'm working with a group right now, a very wealthy individual. He's probably a billionaire. He's had 4 or 5 entities. He's had all his family members enrolled in a Blue Cross Blue Shield plan. Well, he's in his 90s now, and many of his family members are well over the age of 65. None of them are working anymore. But this gentleman is incapacitated. He hasn't been drawing a paycheck for years and years. So technically, that group insurance plan that he has through one of his entities that he used to own or be a part of is not credible coverage. So he's staring down years and years worth of late enrollment in Medicare Part B. His Part B premium is likely going to triple or quadruple from the standard premium that he would have normally been assessed had he been in a creditable plan. So, I just want to forewarn you, that's very important. You want to, just make very sure, very certain that you're enrolling in Medicare at the appropriate time. Same holds true for Part D. I will quickly point out that, in addition to the Part B penalties, Part D and Delta penalties are assessed as well. So every month that you go without creditable prescription drug coverage under Medicare, Medicare imposes a 1% cumulative penalty on you, and that never comes off. Okay, so a quick example. Let's say you go 2 years without creditable prescription coverage under Medicare, 1% per month over 2 years is 24%. So Medicare, when you do sign up, Medicare would tack on an additional 24% on top of your premium that your standard premium that you pay for the Part D plan. And again, that never comes off. And so we want to try to avoid all these penalties and potentially going without lacking creditable coverage. And so for those reasons, I would invite you, if you have any questions at all, I would be delighted to talk it through with you, either by email or telephone. You can call me at 281-255-4444. My email address should be listed on the screen here, michael.steele@aleragroup.com. And so with that, I will open it up to any questions that you may have.
Hi, Michael. Thank you so much. Yes, we do have one question right now. It says, can someone enroll in Medicare at age 65 if they do not have insurance coverage for the prior 2 years?
Great question. No matter whether this individual has creditable coverage or not, everyone who has worked at least 40 quarters, 40 quarters being 10 years of work history, as long as you've worked at least 10 years and paid into the system, you are automatically entitled and eligible to sign up for Medicare at age 65. And by the way, Medicare A and B is designed to start the first day of the month in which one turns 65. So if your birthday falls on November 5th and you're going to be 65 in another week, your Medicare would automatically begin on November 1st. Okay. The one exception to the rule is if your birthday falls on the first of the month. If your birthday falls on the first, Medicare will give you an additional month of coverage. So if your birthday was November 1st, you would actually be eligible for Medicare beginning on October 1st. So I hope that helps.
Thank you, Michael. I don't see any other questions here, but if you can email me your contact info, and if possible, your presentation. What I'm going to do is this webinar has been recorded, so we will post this on our website, as well as we'll post Michael's contact information, so that if you do have any further questions later on today or this week or coming up, please reach out to him directly and he can assist you with that direct question. At this time, I want to thank you, Michael, for your time. I know you're very busy right now, and so I'm really thankful that you've taken this time to talk to us, to talk to our group, because it's been very helpful. You did this last year, and we truly appreciate it. And so thank you again for doing it this year. I hope everyone that's been tuned in have learned something about Medicare. It's very complex, but that's why we have people like Michael that we can turn to for these complex questions. So without any further ado, I want to say thank you, and hopefully we can see you next year.
All right. God bless. Bye-bye.
Bye-bye.